see.
Are we showing now or what exactly? We're muted from everyone or we're not?
No, not yet. But we're showing. I think we're just giving like a couple of minutes for anyone else joining, and then we'll begin.
Thank you.
Hi everyone, this is Pooja Tiwari. I'm one of the co-organizers for this event. We will be starting in 2 minutes to give a chance to anyone that hasn't logged in yet to log in. Thank you.
Hey Maria, can you hear me okay? I got disconnected earlier.
Yes, we could hear you.
Okay, just double checking.
Hello everyone, thank you for attending our virtual Prioritizing Your Health event this Thursday evening. My name is Pooja Tiwari and I, along with co-organizer Maria Rodriguez, work in the Stakeholder Relations Department at Valley Health Plan under our manager Ashley Bejarano. I will now hand it over to my co-organizer Maria to say a few words.
Thank you, Pooja. Hi, everyone. My name is Maria. I am very excited to host these events along with all of our departments and partners. Pooja and I wanted to provide our community with informational events that we would all find helpful during this pandemic. We can't thank you enough for participating and for taking time out of your busy days and joining us. So now I will hand it over to Pooja to speak about our agenda.
So our agenda for this event is as follows. First, we will have Dr. Murphy discuss COVID-19 and the flu. Next, we will have Fernando from Health Education present. And finally, we will have Martha from Member Services Department also presenting. Everyone else who is not presenting will remain muted. If you have any questions throughout the presentations, please write them down. There will be time at the conclusion of all the presentations to have a Q&A session. But now we will kick off the presentations by starting with Dr. Murphy. Dr. Murphy, can you please unmute yourself and introduce yourself and your role at Valley Health Plan?
Hi, I'm Dr. Elizabeth Lisa Murphy, and I'm Medical Director at Valley Health Plan.
Thank you, Dr. Murphy. So First up, a kind of question that we have for you. As the COVID-19 pandemic continues to unfold, what are some things that we can do to still keep us safe during this pandemic?
Well, the most important thing that you can do to stay safe from COVID-19 virus is to always wear a mask. Unlike many other viruses, COVID-19 lives and gets spread through the air. Flu virus spreads if you cough, but COVID-19 virus can spread just through talking, singing, or normal breathing. So the most important thing you can do is to always wear a mask, particularly when you're indoors. We recommend a multi-layer mask, usually at least 2 layers. We recommend that you don't wear a mask that has a one-way valve in it, like the mask that you wear to do construction work or sanding or home projects, because those masks expose others since you breathe out onto others. The American Academy of Pediatrics has also recommended that children over 2 wear masks. So if your children are in childcare or in school, they can also wear a mask. And finally, you may want to wear a mask even indoors at home sometimes if you have a family member who's particularly at risk, sick or very elderly, to prevent spread of the virus. Part of the spread of the virus happens by social distancing. The prevention happens by social distancing. So since the virus spreads through the air, the farther away you are from other people, the less likely you are to get the virus. The mask doesn't completely protect you from getting COVID-19, but we know that with this virus, how much virus you're exposed to matters. So if you're distanced from people and you have your masks, the amount of virus that you could come in contact with would be very low. And we also know that if you were unfortunate enough to get the disease, you'll probably have a milder disease if you wear your mask and you keep distanced. Finally, COVID-19 doesn't live as well on surfaces as flu virus does, but you could still potentially get it from surfaces. So just always wash your hands before you eat and avoid touching your face and mouth.
So Dr. Murphy, in addition to the COVID-19 pandemic, flu season is coming up. We hear about it every year, but what makes this particular flu season different? Like, how are flu prevention measures different than COVID-19 prevention measures?
Well, one thing that's important to consider is that right now the hospitals are very full with people that have COVID-19. And this is we're starting into flu season, which really starts pretty widespread by December. So if the hospitals are filled with people who have flu and COVID, we could really start experiencing problems with getting health care. So it's very important that we prevent flu. It's always important, but it's more important than ever this year. The flu virus, the most important thing you can do is get a vaccine. Unlike COVID, we have a vaccine. And the vaccine's very effective at either keeping you from getting the disease, or if you get the disease, you get a very mild disease. So we want to vaccinate ourselves, and right now is the time to do it. Flu usually is sporadic. That means here and there. Cases are happening now in October and November, but it becomes very widespread each year in the middle of December. If you get your vaccine now, your body starts to build up immunity to the flu, and it takes about 4 weeks to really get immune. So between now and early November is the time to get vaccinated so that you can really have your full defense system going when flu becomes widespread in December. The county is offering free flu vaccine clinics or outdoors at the fairgrounds every Saturday from now till the end of November, and Martha from Member Services will tell you more about how to get the vaccine. The second most important way in preventing flu is, unlike COVID, flu lives on surfaces for a long time. Flu doesn't go through the air very easily unless you cough directly on someone, but it does live on surfaces. So if you're out and about in the grocery store, etc., and you're touching surfaces in your house, The virus can live for a long time. You can't get the virus unless you get the virus into your mouth. So it's really important. Wash your hands before you eat. And don't eat at the computer because you're touching your keyboard, you're touching your desk, and then you're touching your food. So it's important to make sure that you continue to practice good hand washing hygiene. Lastly, cover your cough so you don't spread the flu to others, although wearing a mask is also very effective, and you'd already be doing that for COVID.
Thank you. And so Dr. Murphy, can you tell us a little bit about who is most at risk during this season?
Well, first of all, it's very important to know if you're at risk. There's things about ourselves that put us at risk. And for people who are when I mean by at risk means you're at risk of really getting a more serious COVID-19 infection or more serious complications and pneumonia from flu. So it's really important to understand if you're at risk, because in that case, you especially want to make sure that you wear your mask, that people around you are wearing your mask, that you're not in settings with big crowds of people or in crowded environments. For COVID-19, the main risk factors are being age over 65, having diabetes or high blood pressure, obesity, and having more severe lung disease, such as severe asthma or emphysema, or heart disease, such as congestive heart failure. Another risk factor is if you have a weakened immune system. If you have cancer, you have a weakened immune system. It's harder for you to fight viruses. And some medicines, like prednisone for asthma, and other medicines that transplant patients take, or biologic drugs that you take for Crohn's disease or psoriasis, actually weaken your immune system, so you're a little more at risk. The risk factors for flu are a little bit different. Whereas COVID doesn't affect very young children that severely, flu, children less than 2 and infants are at very high risk, and so are people over 65. Also, flu is very risky for pregnant women. So you want to make sure that if you're pregnant, you're getting your flu vaccine. Finally, people with chronic lung disease and asthma, kids with asthma, very important to get flu vaccine, because the complication from flu is pneumonia, and it happens much more frequently if you already have an underlying lung disease. Again, as with COVID, if you have a weakened immunity, you're also more at risk for flu.
Thank you, Dr. Murphy. Do you have any general prevention tips for staying healthy and fighting infections?
Well, I'm glad you asked that, because our body's very good at fighting infections if we treat our bodies well. But we have to treat our bodies well and be healthy and not be run down. And one of the most important things is a good diet, and that means lots of fruits and vegetables. There's a lot of antiviral compounds in fruits and vegetables, vitamin D in milk, so low-fat dairy products. It's also best to avoid processed, high-fat, high-sugar foods. The rule of thumb is look at the ingredients on your foods, and if there's a lot of ingredients in there that aren't in your kitchen, that's a processed food. Also, exercise is very important for your immune system. Getting at least 30 minutes a day, even moderate exercise, is important. And exercise outdoors helps boost your mood, decrease your stress, and gets you more vitamin D. The other really important factor for all these people that are having health problems and that are at more risk is to make sure your medical problem is under control. We know that diet and exercise helps improve diabetes. So you want to do the best to control your diabetes. It also helps high blood pressure. But we also know you need to continue taking your prescribed medicine and continue seeing your doctor for all your underlying health conditions. So you'll be more resistant to having a severe infection. And finally, make sure you get plenty of sleep.
So now that we are aware of similar symptoms found within COVID and the flu, which symptoms distinguish both from each other, Dr. Murphy?
I'm sorry, I didn't hear that. Oh, what the symptoms are that are different from each other?
Yes. Yes.
I'm sorry.
Okay.
So COVID-19 you can have fever, cough, and muscle aches, but you don't have to have a fever, and you don't have to have cough or muscle aches. The onset of COVID-19 is usually much slower and progresses fairly slow. You may not have many symptoms at all. One very concerning thing that happens with COVID-19 is you can get shortness of breath and your oxygen levels can get lower, even without much cough or fever. So we'll talk in a moment about some of the ways you might be able to detect that and make sure you get help for that. Another really unusual thing about COVID-19 is that it tends to make people, in some cases, not all, but many people who get COVID lose their sense of taste or smell. And that's just a sudden, you can't smell your flowers, you can't taste food. And it's because COVID seems to affect a part of the brain that really processes taste and smell. So if you get a sudden loss of taste and smell and no other symptoms, that's a reason to get a COVID test, just to protect the people around you and to kind of know where you're at. You can get sore throat. And then again, you should know that you can have COVID even with no fever. Flu, on the other hand, is kind of a sudden, severe onset. You usually know when you have flu, and it happens all at once. You have fever, you're feeling feverish, you have chills, you have coughs, but mostly you have muscle aches. We always tell people that the difference between a common cold and flu is the muscle aches, because you usually feel really bad body pain with flu. You can have sore throat, runny nose, headaches and fatigues, and some children may have diarrhea. But with flu, particularly in older people who have weakened ability to mount a fever, you might not have much fever even with the flu.
Thank you, Dr. Murphy. So now that we know the symptoms, how do I know when to seek help?
Well, that's a very good question, because the sooner you seek help when you're having a problem with COVID, the better chance you are of, getting a treatment and doing fine. So one of the things that happens with COVID is that people's blood oxygen level, that oxygen can get low. And sometimes they're not really aware. Oxygen helps you think, so you may not even notice what's happening to you, because you may feel like it's hard to think and hard to concentrate, and you may not notice you might be getting into trouble. So the things that you and your family members should look for, particularly if you've been diagnosed with COVID, but even if not, is, are you really getting more short of breath? You take the flight of stairs in your house you always take, and now you're short of breath. Are you having confusion or difficulty thinking straight? Are your family members noticing that you're really just not acting right, like you can't think clearly? Are you getting chest pain when you're breathing deeply? Of course, any chest pain, you're going to want to go to a doctor if it lasts for any period, but chest pain with deep breathing can be another sign that you're getting into more serious problems with the COVID-19 infection. And finally, you can actually have bluing around your lips and graying of your face. These are the symptoms that we would really be concerned about, and we would want to seek help. If you have a chronic medical condition and you're diagnosed with COVID, your doctor may actually even prescribe an oxygen monitor for you at home, just to make sure that they can track you and you can come back early to get additional help for the COVID infection if these symptoms occur. Again, we don't want you to get COVID. We hope if you get it, you'll wear your mask and have socially distanced, so you'll only get a very mild case because you won't have gotten much virus. But if you do get it, it's important to prevent having a serious outcome from that disease at every phase.
Thank you, Dr. Murphy, for all the great information you've shared with us. Up next, we have health education. Fernando, could you please unmute yourself and introduce yourself?
Yes, hi everyone. Can you guys hear me okay?
Yes, we can.
Good. My name is Fernando. I'm with the Health Education Department. I have a degree in nutrition and I'm also a certified personal trainer. So I'm going to go through a lot of services that we offer. We're not just on nutrition and exercise, but things like stress management. Um, Thank you, Dr. Murphy, for all the wonderful information you presented. My goal of this presentation is how to get all that information and put it into action and show you what is available to you through Valley Health Plan.
Thank you, Fernando. So to begin, where can we find healthy eating resources?
Yeah, so good question. Most of all our resources are available on our website, valleyhealthplan.org. As you can see there. So we update this website pretty regularly. All our services and programs are listed on there. I recommend you check out our page. This, for example, as you can see, that's our team there. It's only 4 of us, but we do a lot for us 4 people. We offer a lot of classes and programs from, Weight Watchers to YMCA Diabetes Prevention Program. But today we're going to focus on the nutrition piece and the physical activity piece.
Great. Thank you, Fernando. Oh, sorry. Go ahead.
So for nutrition, you can, if you can show the nutrition slide, please, Ashley. Should be the next one. Okay, thank you. So like I mentioned, today we're going to focus on fitness and nutrition, which is very important, like Dr. Murphy just mentioned. And then we're going to go into a little bit about our Weight Watcher program because they also offer a lot of very valuable resources and tools that can really help take care of your body and your mind so that, you can better fight off the flu. But this is just a list of what other services we also offer as well. It's a very comprehensive list.
Thank you. So what about physical activity? Where can we find information on staying active safely?
Can you go to the nutrition slide that's next, Ashley? Yeah, great question. So for the physical activity piece, we offer several fitness classes. We range from jazzercise to total body fitness to yoga and Pilates. But with COVID, obviously, we're unable to host any more of our physical fitness classes. But luckily, we have brought a virtual class platform to our members. So members could just go on our website and they can simply click and join any of our 6 classes from anywhere in their house or anytime they'd like. So basically, as you can see here, we have listed our 6 classes. Currently, we offer a sports conditioning class on Tuesdays. Most of our classes are 45 minutes long. And usually when you log on to the class, you'll click the Zoom icon there, and then you'll type in the password fitness. And then once you do so, it'll show you who the instructor is, and you'll see what kind of equipment you will need. So you're not caught off guard when the class starts. You will have the option to share your screen. A lot of our members do like to share their screen so they can feel like they're more in a classroom setting. And it does make a difference for some. So I would definitely encourage, to get moving, make sure your body's healthy and strong, especially during the flu season, especially with the winter changing. It might be a little more difficult to get outdoors and do some outdoor activity. But this is a great option for those that you can do fitness anywhere inside your house. And most of these classes have very minimal equipment needs, with the exception of perhaps the sports conditioning. But I highly recommend you give that a try. And we also offer it's also on there listed as an aquatics program. Currently, due to COVID, this is temporarily shut down, but we do normally offer a aquatic membership at no cost to our members. We do have a class fitness schedule that's aquatics based, so meaning you're doing fitness classes on the water. This is really good for people who might have a lot of pain management issues or can handle a lot of impact on the joints or can have some weight issues as well. This is a great option to get some great exercise. And we also offer another free membership where members are allowed to go in and swim on their own at their own leisurely pace. And again, both memberships are covered for free for Valley Health Plan. So we highly encourage you to do that. As far as when that will be available, I would make sure you contact Health Education, and we will let you know as soon as we hear anything, any updates on when that will resume.
Great. That's all really great information.
Did we skip the nutrition piece already, Maria?
The nutrition piece, I think that one was the next slide.
Okay.
Yes. So what about the resources available for stress management?
So great question. So stress management can come in several forms. Obviously, the flu is the one we're focusing on today, but there could be a lot of stressors that you can also minimize that we do have control over. A lot of these can be more of how to manage your health, your stress. Obviously, I think we're in a very unique time where we're indoors more, we're more with our thoughts, and it's even more important now than to kind of be more mindful about your health and obviously more gentle and kind with those thoughts you have about yourself. We do have a great relationship with Weight Watchers currently, and they offer we offer a 50% discount to anyone who wants to be a member for Weight Watchers. There's 2 different membership types, and basically they offer the Headspace app, which is a really unique and comprehensive mental health, mindfulness, and meditation app that's really popular, and that's also included for those who want to take advantage of that. All you would have to do is go on our website and subscribe to Weight Watchers, and then Valley Health Plan will be paying 50% of the of your subsidy. So as long as you keep paying the monthly payment for Weight Watchers, Valley Health Plan will continue to pay the other half. So this is how we encourage members to kind of take care of their health. Also we want to make sure that we take care of some of those fees as well.
Thank you, Fernando. Ashley, can you please put the nutrition slide?
Yeah, I think I might have missed that one. There we go. Yeah. So this is a very big topic. Obviously, we heard a lot about nutrition already from Dr. Murphy, which is really important. And we know that food is medicine. So if we can put in some good food in our body will obviously be not only stronger, but our immune system will be as well. And then obviously we'll be able to fight any kind of stress, whether it be from the flu, any other, or even through any kind of accident that we might come in contact with. So obviously we want to focus on eating a lot of high micronutrient foods. What micronutrient foods are basically anything with a lot of vitamins and minerals. In particular, you want to focus on foods that have a lot of vitamin C and E. Obviously I would go for the citruses, oranges, grapefruit, and limes. But also berries are really good for you as well. And then obviously you want to stay hydrated. Obviously, when you're fighting an infection, your body temperature goes up, so you want to make sure you're even drinking a lot more water to cool yourself down, but also you also want to make sure you're staying hydrated. That's also another key factor in making sure your immune system is performing optimally. But if you want to learn a lot more nutrition as far as how to eat healthy, we do offer a lot of services and programs. We do have on our webpage, as you can see in front of you, some nutrition tips. And then we also have a lot of recipes that are very simple that you can do at home. Now that we're at home more than ever, I think a lot of us here would agree we've been cooking a lot more. And obviously there's a lot of recipes there that you can take advantage of as well. And then obviously one other thing is, when it comes to fruits and vegetables, you want to try to eat what's in season. Obviously it's obviously going to be a lot cheaper as well. And so we also have a list of all of our farmers markets. So if you click on the farmers market icon there, it'll take you to all the farmers markets location in Santa Clara County. So I would suggest you go there as well. And then one other resource that we offer is our nutrition classes. We have partnered up with the YMCA, and we offer free nutrition classes courtesy of YMCA. We have dietitians that give cooking demonstrations and also talks as well. The next talk we have, I believe, is November 24th. Yes, it is 24th, and it's called "Let's Make Soup." I think it goes hand in hand with the flu talk we're talking about today. It says, "Learn how to boost your immune system through diet, learn which foods inhibit our immune system and which ones make us stronger and less likely to get sick. And then also they're going to be focusing on some healthy gut bacteria as well, looks like on that talk. So I highly recommend you take advantage of that free nutrition class. And they are also virtually as well due to COVID as well. And again, all these services are available on our website. So just make sure you visit our website, www.valleyhealthplan.org, and then just go ahead and pre-register. And that's all I have as far as for nutrition services that we currently offer.
Thank you, Fernando. Up next, we have Martha from Member Services. Martha, can you please unmute yourself and introduce yourself and your role at Valley Health Plan?
Yes. Hello, all. My name is Martha Cisneros, the Member Services Manager for Valley Health Plan.
Thank you, Martha. And so a question for you is, how can a VHP member use their benefits to take action on all these different recommendations from Dr. Murphy and Fernando?
Yes, absolutely. Well, let's start with ways to get your flu vaccine. You can contact Valley Health Plan Member Services and we'll help you identify where to go, answer some of your general questions. You can walk into any Walgreens, Safeway, CVS, or Costco pharmacy that is offering the flu vaccine and simply provide your VHP ID card. You might say, well, hey, Costco requires me to be a member. Actually, you do not need to be a member. You can actually get that for free using your VHP ID card. Just let the person at the front know that you're there for pharmacy services and they'll let you walk right in. Also, you have the option of contacting your primary care physician. You can schedule a vaccine appointment. The fairgrounds in San Jose is also offering free vaccines every Saturday through mid-December from 9 a.m. to 4 p.m. No appointment needed. That is very convenient for those that are working or need assistance with childcare, and maybe only weekends is an available option. So definitely take advantage of that. It's also important to know that flu vaccines are free. It's absolutely free as a preventive service to our VHP members. Additional information about flu vaccines or where to go can be found on our website at www.valleyhealthplan.org. I also want to take a few moments to say we have other important services that are offered by VHP that are absolutely free. No copay, no deductibles apply, and that's preventive care services with your primary care physician, which can include general well health exams, well woman health visits, mammograms, diabetes, cholesterol screening, routine immunizations, laboratory and services as it relates to disease prevention. That is extremely important to maintain your health. So that is something that we definitely want to highlight today.
Thank you, Martha. And so we've heard that VHP has a telehealth option. Could you tell us more about it?
Yes, absolutely. MD Live, that is a valuable service to our VHP members. You can speak to a doctor 24/7, anytime, anywhere, resolve medical issues for non-emergency conditions, establish care with a behavioral health professional, a therapist, psychologist, psychiatrist. This is actually really beneficial for those that maybe want to maintain some privacy, don't want to go to a doctor's office. You can do this, again, 24/7, convenience from your home. No prior authorization required for any of the services offered through telehealth. Some of the conditions that can be addressed would be like allergies, a cold versus flu, a cough. Some of those items that you maybe would be going to an urgent care for, you can actually call into our telehealth service and get triaged by a medical provider, right? So you're not feeling well, you don't want to sit in an urgent care waiting for a doctor. You can now call, do a video chat, whatever's the most convenient for you, still get the care and still get your medication. Next slide. Okay, so this is our contact us section, and we are here to serve you. Please feel free to contact us, member services, health education, the sales and broker relations team. We are available by phone and email. Outside of shelter in place, you'd be able to visit us at 2480 North First Street, Suite 160. But due to the current conditions, please feel free to reach out to us by phone or email.
Thank you, Martha, for all that great information. So now it's time for a Q&A. This is a part where we are going to give everyone the chance to ask questions. You can unmute yourself or as well type it in the chat, and one of us will go ahead and answer it. So if you guys have any questions, feel free to either raise your hand, unmute yourself, or type it in the chat.
I just wanted to say this has been a really great presentation. I hope you can hear me.
Yes.
Yeah? Okay, I'm seeing nodding heads. So a lot of great information provided, from nutrition to what to look for in terms of symptoms around either COVID-19 or the flu, and resources that we can seek at Valley Health Plan. So I just wanted to say thank you for putting together this wonderful presentation. It was so comprehensive that I really don't have any further questions, but hoping that others who may hear the recording and are interested would be able to reach out to VHP and seek our member services.
Absolutely.
Thank you. Yeah, so if anyone doesn't have any questions, we have a couple that we would ask each department. Maybe we can give everyone else 2 more minutes to ask questions, and then if there isn't any, then we'll go ahead and ask 3 questions that are commonly asked.
So I have a question for Dr. Murphy. So it's in respect to kind of COVID-19 and like flu and sort of the differences in like managing the symptoms. Because like with flu season, right, whenever you get sick, you usually like either do like cough syrup or some sort of syrup, or like, you know, pills to like reduce your fever and stuff like that. Could someone, like, say if I were to contract COVID, or someone that I know, in order to manage our symptoms, could we use those same remedies, or are there like differences?
Dr. Murphy, you yourself.
There, can you?
Yeah.
I would say, in general, for flu or for COVID, or whenever you have an illness that could get you very sick, you want to make sure you're getting plenty of sleep, that you're drinking plenty of liquids, that you're eating healthy, you know, juices, fruits, and vegetables. You can take things like Tylenol for pain. You can use ice for body aches. And I think that the most important thing is to just, you know, protect others in your house, wear a mask. If you have COVID, you know, maybe stay in your room and don't share the same bathrooms with other people in your house. I forgot to mention, you know, that some people are at risk just from what they do. You're a healthcare worker, so you may even see COVID patients. You are an essential worker, so you work delivering Amazon or in the groceries, etc. So it's really important that, you know, people that, you know, you work with crowds, etc., that everybody's very careful about contracting the disease, and if they do get the disease, that they're very careful about preventing their families from getting the disease, particularly for those of you that live in multi-generational households. So I would isolate yourself from other people. For sure, don't share glasses or any personal care items. Try to have your own bathroom. And then just lots of rest, Tylenol, and know the symptoms for flu as well as COVID. If you start to have problems thinking straight, problems with getting more short of breath, because with flu you can get pneumonia, and any of those kind of danger symptoms, just make sure you go in then and see your doctor. Or feel free to jump on MD Live if you're concerned about specific symptoms to see if there's something that they can offer.
Okay, thank you, Dr. Murphy.
So I have a question for Fernando. So when discussing indoor and outdoor activities, which one would you advise us to do more during these times?
Interesting question. Yeah, definitely times of, with the closing of fitness centers, we're a very interesting time right now. I think now more than ever, a lot of people are purchasing a lot of their own equipment and actually choosing to work out indoors. I know personally a lot of businesses are having a hard time keeping up with the demand or supply, I should say, of equipment that people are trying to buy. I definitely think that exercise can be easily done at home, as I just mentioned. We do offer a pretty comprehensive list of virtual fitness classes that can be done at home. I think the main key thing is obviously whether you're doing indoor or outdoors is try to do it with someone else. I think right now we're in a time where it's easier to connect, to do exercise when you're connected with someone. And obviously, with the technology now, I think, having, scheduling a Friday Zoom group workout is not a bad option. Actually, I do that myself. I think a lot of people are doing more of a training inside their house virtually with other people. And that seems to work. As far as outdoor, I think that can be done safely as well. I know a lot of people are in purchasing bicycles, I know myself, I just ended up buying a used bicycle on the Facebook marketplace. I think, riding bikes is something that can be done safely, and obviously the great exercise. And not only that, you're getting your vitamin D, like Dr. Murphy said. So there's a lot more benefits, I would say, to exercising outdoors, but just make sure you're safe, make sure you're wearing a mask. And if you are going to have someone join you, obviously just be a little more safe with the 6 feet distance. And yeah, a lot of sports, there are certain sports that can be done outside as well. Golf is one of them. I know a lot of golfing ranges are getting really busy right now. I learned the hard way. When I go to the range, it's pretty long lines, but everyone has a mask and you're outdoors and everything is pretty spaced away. But yeah, I think the main takeaway is be safe when you are exercising in a group and try to work out in a group if possible. And like I said, virtually is a good option for indoors.
Great. Thank you so much for that advice, Fernando.
So there was actually a question in the chat for you, Fernando. And the question was, are those classes scheduled or on demand?
They're live. Good question. Very good question. I didn't clarify. So yeah, these are live classes, so you can interact with the instructor. So they're on a live feed. So it'll be the same instructor for that particular class per week. I would just recommend going a little early, signing on a couple minutes early your first time. Maybe introduce yourself if you do have any limitations, so that the instructors are aware of what your needs are.
Thank you, Fernando. And so now the next question is for Martha. And the question is in relation to getting the flu shot. So you mentioned at the fairgrounds, you don't need to make an appointment. You can just walk in and get the flu shot. But what about, could you clarify for places like Costco and the other ones you mentioned, do they also have walk-ins, or will you have to schedule an appointment for those locations?
Right, so that's a good question as well. So no appointment needed outside of your primary care physician. You do want to be respectful of their schedule, so you do want to call your primary care physician in advance. But the pharmacies, no, you do not require an appointment. You just walk in, let the flu clinic know that you're there for a flu vaccine. You show your ID card. And same for the fairgrounds, no appointment needed. You just go between the hours of 9 to 4 at the fairgrounds.
Okay, thank you, Martha.
Okay, great. Thank you for all those answers. It's really great advice. Does anyone else have questions? Okay, so it seems like no one else has questions. I'll hand it over to Pooja for some concluding remarks.
Thank you, Maria. So we just want to thank again for everyone who attended this event, from our presenters to our attendees and our different Valley Health Plan departments for putting this event together. Since this event was recorded, you will be able to find it on the Valley Health Plan YouTube page after this event. And in case you did not know, this was the last of 4 virtual events that Valley Health Plan put on. The other 3 were a broker enroller open house, Health Insurance 101, and Shop and Save. Since Health Insurance 101 and Shop and Save were open to the community, you can also find those 2 event videos already on the YouTube for Valley Health Plan already. Now, that is all we have. I hope you all have a good rest of your evening. Thank you again.
Thank you, everyone. Have a great weekend.
You.
Thank you.